tahia ke he moa ke te kakoa ko ke here mai te kaua kore ke he tataki mai roto mai I tanga pūkano kāno whaika. Ko aka marangaranga, ka tahi te manu ka tau ki te tāhuna, tau atu, ka tau mai. Nō reira ko noko hui ki te manaki kia tai mai nei ke rātou kua wehe. Nō reira, tēnā koutou, a kia mai tātou katoa. Ako te mea te utai ko tēnei te mihi atu kia a koe I te kai karanga. Ko koe he karanga atu kia mātou nei ka kawea mai a mātou, kei rungi I tēnei kaupapa I tēnei ata. Ko koe e whakarāranga mai a mātou, e roto I tēnei kaupapa. Nō reira mihi, ngā mihi atu kia a koe e te wai. Mihi anō ki kia a koe Matua Rex, ko koe ko te pau kei roto I te kaumātua kaunihera mai I te taituka rau hei awhi manaki tia mai kōrua, hei awhi manaki tia mai a mātou. Mea mātou manuhiri ka haru mai nei kei runga I tō tātou whenua, mai I te taituka rau. Nō reira, ngā mihi anō ki kia koutou. E mihi atu ki a koe mare, ko koe e timatai mō tātou, kei runga I te āhuatanga o tātou mātua nui tarami. E tika ai ki a tātou e mihi atu ki tōna ingoa tapu, hei awhi manaki he korowai a mātou I runga I te rā, I te ata. Nō reira, mihi anō hoki ki a koutou. Kia tātou katoa, ko tēnei te mihi atu ki a koutou, ahoko kei a tai mai a mātou minita, me te komisiana, e hara mai I runga I tātāua kōrero, e whakapua wai e a tātou, he whakamārama mai a mātou, me ngā kōrero I tēnei ata. Nō reira, mihi atu ki a koutou, he karanga atu, he pōhiri atu I a rāua, me o tātou kōtiro, I tai mai nei ki tēnei taha. Nō reira, e tika ai me o tātou tika nei o te taitokura. E awhi, he tū, ki a mau atu ki o tātou tikanga mai te taitokura. Nō reira, hoino. E mihi atu ki a koutou, he toko maha ki a koutou ka hara mai nei I tēnei wā he tautoko. Me tēnei o tātou minita, me o tātou kamihana. E tika ai ki a tātou he whakatū mai I ngā whakaahua me ngā whakaaro pai o tātou tini Māori me a tātou katoa o Aotearoa. E tika ai ki a tātou I tūtunu kei roto I tēnei ngā tikanga. Ahako, e iti I tapu nei kōrero, me mihi atu ki a tātou maunga teitei, ko maunga manaia, me parihaka I kona, ai e tūtunu ki a rātou, tūtunu. Mihi anō hoki ki a tātou, mai I te tātou mai I muri whenua, taino atu ki pewhairangi, te terenga pāwa mai atuna tahi. Ahako, ko ngā whenua e whakanoho nei ki a tātou katoa I te taitokera. Ahako, e iti nohi o taku kōrero, ko haere te wā, e tika ai ki a tātou e tūtona kōrero I tēnei tātou. Nō reira, horino ki a tātou katoa, tēnā koutou, a kia ora mai tātou. Now that we've come to the conclusion of our kaupapa ki tēnei wā, I just want to sort of lay out how we're going to go. What we're going to do now is we're going to have the announcements done by the Minister, followed by Commissioner Levy, Mr. Levy, and then we'll have media Q&A queries in regards to that. And then from that point, once we've finished that, we'll do a closing prayer. Ki te pai tēnā? E te marama? Ai. Kia ora tātou.
Kia ora mai tātou. E tuatahi ki te kaikaranga e whaia tēnā koe, ki te kaikarakia, Matua Rex, tēnā koe. E raurangi tina mā, ko tēnei takumihi e tuku ana ki a koutou I tēnei morena, kia ora mai tātou. Good morning, everyone, and thank you for the warm welcome and for joining us at Whangarei Hospital this morning. In Budget 2024, the Government made a record investment in health of $16.68 billion over 3 budgets. With this funding, we expect to see improvements in services to New Zealanders. That won't be without challenges, as I made clear when I appointed a Commissioner to Health New Zealand, with the clear direction to cut wasteful spending, strengthen the front line, and put funding and decision-making directly into the hands of the regions. Since being appointed as Commissioner, Professor Levy has worked hard to find efficiencies and get Health New Zealand back on track. So I'm pleased to be here alongside Professor Levy to announce a package of initiatives aimed at strengthening our front line so we can provide Kiwis with safely and timely health care. There are 3 parts to this announcement today. First, senior doctors are key to keeping our hospitals functioning well, maintaining safety for patients and staff, and delivering quality care for New Zealanders. Health New Zealand will fund an additional 50 senior doctors for regional and provincial health services to help reduce wait times, enhance patient safety, and support vulnerable specialties like dermatology. Second, while Health New Zealand has made significant progress recruiting nurses in the last 12 months, there are critical shortages in rural areas and particular specialties such as mental health, maternity, and critical care. We are therefore investing $10 million to create new roles for senior specialist nurses and allied health professionals. Setting aside funding specifically to employ senior specialist nurses and allied health professionals will help sustain services that are struggling because of a lack of specialist skills. Thirdly, we are establishing a $12 million fund for minor improvements to hospitals to make the daily lives of frontline staff and patients easier. This fund, divided between the 4 regions, is aimed at making small improvements that make a big difference. There could be minor repairs, replacement appliances, or new books or toys for children undergoing treatment. It's up to each region how they make use of this funding, but I expect them to be able to access it quickly and easily so they can get recruitment and minor repairs underway. I look forward to seeing the differences these 3 initiatives will make for our highly valued frontline staff and the care they provide to New Zealanders each day. I'll now pass the time over to Commissioner Professor Lester Levy.
Thank you, Minister. Kia ora koutou. Just like to start by acknowledging Kaumata and Kuya. We are privileged to have you work with us in service of our patients, whānau and community. I'd also like to acknowledge mana whenua. Come today as a visitor with great respect for mana whenua, so thank you very much. Yes, today's a really good day because we're not having those every day. It's quite a challenging environment. As the Minister says, we've been working very hard to address some of the issues, as you know, in this complex process of needing to take cost out because the organisation has been in a recurrent situation of spending beyond its budget. But also we need to invest, so it's quite a paradoxical situation. So we've been working very hard to work on the cost out, which is separate from what we're doing today. The announcement that the Minister's made, particularly those relating to the senior doctors and the nurses and allied health specialist staff, those are above budget and are new and are different. One of the things that I have noticed as Commissioner is I have 2 Deputy Commissioners who spend, Kylie Clegg and Ken Whelan, who spend a lot of their time visiting the regions and reporting back. And there is a gap that I believe has developed over time between the regions, the provincial centres and the cities, and I think it's important that we start to address that, and we need to make sure that the resources are better distributed across the whole of the country. And so a critical part of this initiative, as the Minister said, is to strengthen the regions. So I would say a significant number, or the significant number of these new staff moving into the regions. We want to do more to reduce waiting times. In my view, the safest wait is the shortest wait, and over the last 6-7 years, waiting times have increased significantly, at a time when there has never been more funding into healthcare, and at a time there has never been more full-time equivalents, more personnel. We do get, issues and reports and anecdotes around where we are not managing to fill positions. But last year, the 23-24 year, and I take no credit of this because I was only here for the last month of that, was in the last 8 years was the most significant year in which we have an increase in FTE, over 4,000. In fact, that increase last year was equivalent to the increase in the 2 prior years, and the nursing increase in last financial year was bigger than the total increase in any of the prior years. So there is significant funding that has continued to be ploughed into the health system, but I don't believe, in my view, that the public has got the benefit that they should from that, and we're working very hard to improve the productivity of what we do, improve the way in which we work. But there's 2 platforms that I just wanted to mention about our reset that are critical. The first is devolution. So we're moving away from centralization. We've got the regional deputy CEOs in place, but that's not the end point. That's the beginning point. We're looking to devolve resources and decision-making as close to the action as possible. And today is a signal of our intentions around that. And the second one, which we'll be talking more about in the next few weeks, is enhanced clinical engagement and involvement. I'd like to see all of our important decisions made in a clinical frame of reference. That is, clinicians need to work with managers and managers need to work with clinicians, and we're going to get much better decisions. Clinicians are going to have much more influence and much more decision making than they have had in the past. I believe that our intention is to achieve that in a way that's never been achieved in New Zealand before. So I think a lot of this is really good news for places like Northland and Whangarei, because over the next year we would like to see most of the decisions being made here. And the OPEX CAPEX fund that the Minister has talked about, this 12 million, is another signal of that. We want to break down this bureaucracy where it takes so long to get a decision. If something's broken and needs to be fixed, the resource will be here and it can just be done. And we'd like to do more and more of that so we can have local decision making and a much more rapid response. So it's, we will try do more of this. This is only the first initiative of this type to strengthen the front line. But while we're trying to do the cost out, and this at the same time is actually very challenging, but we intend to do everything we can to strengthen the front line and reduce waiting times for patients, which is the most significant issue that our health system faces. So thank you very much.
Thank you. And with that, we're happy to take questions. If media have questions.
Sorry, can we move forward?
Sure, if you want to reposition, that's fine, Denise.
Sorry.
Denise, you good? Good. You're good. Helen, you're good?
I'm good, thank you.
Okay, good. Who's first?
I'm going to grab it as soon as I'm the local. So can you just explain to us how you're planning to recruit in rural areas when there are vacancies in rural areas anyway that you can't fill?
Commissioner, do you want to talk to this?
Yes, so look, I think we have to change our paradigm around recruitment. So we have a very traditional paradigm where people in capability lead the process. It's our intention to flip that, and so we want clinicians to lead the process and be supported by people in capability, and I think if we do that we will have a much more successful recruitment process. I think that we need to do this differently. The best thing about banging your head against the wall is stopping. So we need to stop doing it the same way we've been doing and doing it differently. I think that we have seen a real drop in our turnover. It's less than 2% now. So part of that is because salaries have increased significantly across health professionals. So we don't necessarily have a salary problem in attracting people, because a number of these people will need to come from overseas because we don't have the capacity. And as the Minister said, we announcing this now because we realise that it'll take some months, and we see that with the new cancer medications that we've been quite successful in our recruitment. It just takes a longer period of time to get the senior doctors here. But yeah, I think that we change the way we do it. We need to be more confident, we need to be more lateral in our thinking, and we need to find people. And there's different ideas we've got about how we may employ these people. So yeah, I think it's going to be challenging, but I think it will be successful.
Where are they going to be based? Where's the most urgent regional need?
Yeah, well, people will have to make a case for these, and then it'll go through an approval process. As Commissioner, I'll have the final sign-off because we want to be absolutely certain that there's a straight line that can be drawn between the recruitment of these people or the appointment of these people and a reduction in waiting times and an enhancement of patient safety. So it won't be in the normal way. And I expect there will be a distribution across the country, but we'll see where the best cases can be made. It's quite a significant number of positions.
Surely Taupo would be first on your list?
Well, we're not saying any particular region, but we'll have a look at all of those, and you've heard the criteria: strengthen the regions, enhance patient safety, and reduce waiting times. And each appointment will need to be able to tick each of those boxes.
So how soon will they be?
Well, they can start making applications from tomorrow.
Realistically, where do you think these doctors will come from?
The majority are likely to come from overseas, but many of them will also be New Zealanders returning from overseas. I've had contact from a number of New Zealanders who'd like to come back, and so it'll be a mix.
And how do you get those? Are you enticing these doctors to come back and work?
By enticing, you mean?
Is it pay salary, better pay salary? How do we bring them
No,
back?
well, we have a multi-employer collective agreement, and it'll be based on that and the current way of remuneration. I actually think that some of these jobs will be structured in a way that are going to be very exciting and challenging for people. So I think we've just got to stop thinking in the old downward spiral way and start thinking in the new upward spiral way, and we will be more successful because we're going to do it differently.
I do know some doctors, surgeons who are trying to get work over here from Germany, but they say the red tape and restrictions are just too hard. Would you consider easing up on some of those restrictions?
Well, some of those restrictions aren't from that, but the Minister may wish to talk
Yes,
about
I can talk to that. We're having discussions with the Medical Council around those jurisdictions that we consider as being similar to New Zealand that have expedited registration. So we're having discussions with the Medical Council around that now. South Africa, for example, Germany's another example. So we are looking to understand what the hurdles are to register those people and those skills that we need and their interest in coming to New Zealand. So it is a piece of work currently in progress.
And this, if I might say, is a really important question, because this is an area of very significant opportunity, as you've noted, and that's why this work is, because if we can expand that, that'll be a huge help.
And how much will this cost, this bringing 50 senior doctors?
Well, it'll depend on the nature of the specialties and their experience, but roughly in the order of 20 million per annum.
And does that come at the expense of frontline staff?
It is frontline staff. We are looking to strengthen the frontline, and this is part of strengthening the frontline.
Sorry, my apologies. I mean, does it come at the expense of backline staff?
Well, we've already got a process of cost out, because this organisation, as part of its amalgamation process and even pre that, took on thousands and thousands of additional management and administrative staff. So we're on a process of, I guess, resizing that. But that's part of the back to budget, and that's a process that's in place. And the answer is no. We just need to look at the quality of our expenditure. I think it's quite important for most people to realise that even in a system like ours, which is, by world standards, a reasonably sophisticated system, there is money that is not well spent. There is inefficient and ineffective expenditure in our organisation, and we're trying to turn that into more frontline staff. We are determined to strengthen the frontline, and this is the first signal of that, and there will be others.
But clinicians are saying that if you get rid of all of the administration, for instance, it means that they have to spend more time doing administration.
So, of course, we aren't getting rid of anybody. It's a difficult process, a heartbreaking process, really. So we're going through the process in order to downsize part of the organisation, that it surprises me that it ever got to the size that it did. And one of the things that we have definitely identified is through this process in the last few years, there's been very poor financial controls and other controls that has led to this over-expenditure beyond budget. And so these thousands of people weren't here 3 years ago, okay? So we need to get to the right size, and we need to find a way that makes it work. But the organisation has spent well beyond its budget and has hired well beyond its budget, not only nursing, and of course those staff are being retained, but in the administrative and management area very significantly.
So yesterday we heard that jobs in ICT are going at Health NZ. What other jobs are going?
Well, there's a number of change processes, and there's no jobs going right yet because we're in a consultation process. We're only starting that. But there's a number of areas that aren't of the front line, where there will be more and more change processes over the next period of time. We signalled that really early as part of this reset. We have to get ourselves back to budget. This is characterised often as cost savings. It's not cost savings. The organisation has spent beyond its budget, and we're just trying to get back to that.
You mentioned nurses as well.
Yes.
How many nurses are you looking to
Well, that will depend on, once again, the nature of the nurse and the experience, but it could be in the order of 75.
And just a question from Wellington. You've attributed major blowouts in Health NZ's finances to hiring too many nurses earlier this year. Now you want to bring in more. You can't really have it both ways. Is there not enough nurses, and has the government underfunded Health NZ, or is there too many?
Well, there's a lot of pieces in that question, but you heard the Minister say that these are specialist nurses in specialist areas, maybe in mental health, it might be in intensive care, it might be in a cardiac catheterisation laboratory, and that's the area that we're specifically looking to strengthen. Yes, the organisation did hire more than 3,000 nurses than it had budget for. So we have retained those, and we're dealing with that situation. It's not a matter of having it both ways, or I don't even begin to think like that. The whole focus is on how can we provide to the population of New Zealand accessible quality services that are affordable. Just to address this issue of funding, there has been year-on-year increases in funding of the health system for a significant period of time. Just recently, in the last month or so, there was an article in the New England Journal of Medicine, a study done of developed countries, which showed that New Zealand is actually performing pretty well according to those, including its comparative funding. If you ever look, for example, Australia, which is a wealthier country than ours, we per capita, we spend very similar amounts, close, not quite the same, to Australia, but their GDP per capita is widely different to ours. So I think, I'm not the politician, but I think New Zealand is actually, for its wealth, is fronting up very well on funding. What we need to do in the organisation is we need to allocate and use that funding efficiently and effectively in order to deliver to patients what they need, which is to wait shorter times.
And the 12 million fund set up to repair things that are broken. There was a story about Dunedin Hospital's roof caving in. I mean, the 12 million's not going to go very
No,
far.
no, this is in addition. This is flexibility, so when smaller things break or that, they can just be fixed right away. There's quite a lot happening in Dunedin in order to fix some of the issues. Just remember once again, and I've seen this as Commissioner, people approach me about problems, and when you start dissecting, the problem has been around 10 years, 6 years, 8 years, 12 years. So we're dealing with a lot of historical issues, and that's our reality, and we intend to continue to deal with those. But what I do want to stress is that we can't always say more money. We need to actually get the value out of the money that we've actually got.
While we're in Whangarei Hospital, can we get an update of how the Whangarei Hospital upgrade is going?
Sure. Making progress. If you remember, there are 4 milestones to Whangarei Hospital. There's the enablers, the movement of the whānau house, which we'll visit shortly. Then there's Te Ora, the OPD paediatric unit, and then the acute services block, and then the tower block. Whānau house has already been repositioned, making good progress on Te Ora, and continuing to make a business case progress on the acute services block and the tower block in that order. So making good progress.
When will an announcement be made on that in terms of whether it will go ahead or not?
So each of them, announcement already made on the whānau house, that's already established, and the blessing was a few weeks ago. Te Ora, the progress on that will be announced likely before Christmas, and then the acute services block likely into next year.
And is that still at risk?
No, all progressing. All progressing. The funds are there. The 759 are there.
And just a quick question, have you had a rethink around Dunedin? Any development?
No, we will build Dunedin Hospital for $1.9 billion.
How embarrassing is it that the roof is caved in at Dunedin Hospital?
In that area, we actually applied funds several months ago to the sterilisation area because we were aware that it had deficits. So we'd already tackled that months ago, and that's in progress and approved by the Commissioner.
And that's about a $16, $17 million capex. I might add that that's been around, those problems, for at least the last 5 years, and we're dealing with it very quickly. The Minister noted that to me on a Saturday lunchtime. We called for the business case, saw that it was updated, and approved that on 4 o'clock on the Sunday. So that's the kind of way in which we're trying to work to address these problems. Okay, I keep saying this, but I didn't cause these problems, but I'm going to do my best to solve them. But
And the
there's a lot
$12
of
million
it.
fund,
Yeah.
sorry. How will that be divvied up? I mean, I imagine
Just
all
by-
hospitals could use 12 million.
It's 1 quarter. It's a start, so it's not an end point. 1 quarter into each region, directly to the DCEs. They don't have to go anywhere to get permission. So as things break on the day, they can just fix it. That is just a start of how we want to progress with this devolved decision making.
Very good. Thank you very much.
Sure. Sure, everyone. We're now going to get matua tea, matua reds, to close with the karakia, and then we'll have a short break for coffee and snacks. Sure,
I'll close this part of the prayer. Hei noi tātou. Tātou tēnei mātou whananganei ka whakawhetai kia koe. Mai manakitanga ki a mātou mai timatanga o tēnei kaupapataina hoki ki tēnei haura. Mai ho te manaki mana koutou e tia. Mai ho te māramatanga o na kanawi ki runga kia koutou. Mana anō, te hio te rangi mārie o koutou ai anei. Ke tuna atu. Amen. Mai ora.
we'll close with the break. Set your tone for us.
Okay. I'll introduce you. Yeah, because then she might like do it in the. Oh, yeah.
Lady Creation.